There's been a lot of rapid development with the ability to bring in robotics. There's been a lot of rapid development with these technologies, so it's still an understanding that there's a reason why things have been the standard for a number of years, but being able to incorporate the technology to try to get people back to activities that they enjoy at a quicker rate.
So a lot of people ask what the robot does. The robot really is it's more of an assistant than it is a primary person. So the surgeon's still doing all the surgery. The robot, what it does is it takes data points on your knee or hip and it inputs those into this algorithm, and it kind of shows exactly where you're supposed to put these implants to maximize the benefit for the patient.
Through the use of advanced software and intraoperative imaging called fluoroscopy, which is like X-ray, as it gives us very detailed information on the position, alignment, down to the level of a millimeter. What that does is it allows me to, with confidence, give each patient the best possible hip replacement for their anatomy. That leads to better function, better results, lower risk of complications such as dislocation, things like that.
You know, in a community 25,000, and to have this technology available, it's almost unheard of. I think Faith Regional is really committed to cutting edge technology.
So it's an extension of our skills and abilities to be able to use these robots.
This is robotic surgery at Faith Regional.